Good morning, everyone, and greetings to those of you online. Thank you very much for the opportunity to talk to you. And as Tony said, I'm going to be talking to you about our standards of proficiency for midwives and the importance of midwives as colleagues and those positive working relationships, because none of us work alone nowadays. It's all part of collaboration and working together. And you'll see throughout my presentation some links to our previous speakers in one way or another, and I'll point those out when we get to them. So what I'd like to start off with is just a reminder about the underpinning and the emphasis of our standards of proficiency that were published in November 2019. And the key point about them is that they're all about, at the end of the day, midwives providing safe, effective, respectful, kind, compassionate, and person-centred midwifery care. I have to point it at the screen. So this is a fairly cheerful picture because I emphasize that they were published in 2019, but we launched them all in 2020. And I have a distinct memory of standing on a stage saying that each generation of midwives or nurses has something that they remember for the rest of their career, and that we had tried to write our standards so that they would be flexible enough to accommodate whatever would come over the hill in the next whenever. And I talked about the fact that for my generation, it had been HIV and AIDS. At the start of my general training, nobody knew anything about it, and by the end of my general training, you'd have been, living under a rock if you hadn't known something about it. So, and it's now part of the sort of core of any training in the health service. And of course, no sooner had I stepped off the platform, really, than COVID hit. So it's just a wee reminder that it was quite cheerful when we were launching these. There were cupcakes and there were balloons, and the balloons are really Queen's University students there in the middle, I think, of whom we were delighted that they all turned up, because this all links back to Mary Renfrew's work, because she had been absolutely leading this from the front in the development of these standards at the Nursing and Midwifery Council. And it's important to say that there was a sort of 3-year run-up to these standards. They didn't sort of just get written and then sort of published. We had a thought leadership group, and that thought leadership group at the time took into consideration the reviews that have been written, the world context, and Karen mentioned the State of the World's Midwifery. That was part of the picture, and all the reports that had been published and the evidence in the background, so that we were aiming for evidence-based guidelines that would inform the midwife of the future. And of course, that midwife of the future is now today's midwife. And it's always applied to all the midwives, whether students or midwives in practice, because the standards of proficiency for midwives from the NMC's point of view form the basis of the curriculum in the approved educational institutions or the universities that provide midwifery courses and programs. And Professor Renfrew, Mary referred to the Framework for Quality Maternal and Newborn Health in the Lancet series. This was absolutely the sort of bedrock of our standards, and we used that along with the code to run right through the standards and to underpin them. And you'll see from on the next slide that in particular, the top two, the practice categories of the QNMH, as it were, from the Lancet series, informed the domains that we ended up with as part of our standards of proficiency. And it also obviously picked up on the organisation of care, the values, the philosophy, and care providers. So we ended up with 6 domains, all interrelated and equally important, but they slight differences really from previous standards were the move towards thinking based on the framework from the Lancet about universal care for all women and newborn infants and then having specifically additional care for women and newborn infants with complications. And what I'm going to talk to you about today, this has oddly come out as a yellow blotch. It was actually supposed to be a highlight, but what it does actually say there is promoting excellence, the midwife as a colleague, scholar and leader. So I've helpfully blotted out the one thing that I'm actually talking about, but there you go. So this is going to make the next couple of slides very, very interesting indeed, because I have I've highlighted in yellow all the bits where it says colleagues in the next couple of slides. So note to self, never do this again for a presentation. But at the beginning of the standards of proficiency, and I would say this is one of the things that I think maybe people don't read, they just get stuck straight into the proficiencies. And it's worth reading the sort of introduction, because there's a big section on the role of the midwife in the 21st century, and it's about the role and scope of the midwife of today, really. And the key points that I'm picking out are really that from the beginning, we start talking about the importance of being a colleague, and it's that involving collaborating with, referring to interdisciplinary and multi-agency colleagues. And the midwife has specific responsibility for continuity, coordination of care, and the ongoing midwifery care as part of the multidisciplinary team. And there's also the recognition and respect of both your own strengths and also the strengths of others. And this is sort of emphasized in the wording here, which is around midwives recognizing their own strengths as well as the strengths of others, taking responsibility for continuing professional development and how they can contribute to others' development. So it's not just about developing ourselves, it's about developing the other professionals that we work with and their education. And that includes, as I said, students and colleagues. So what do our standards say about being a colleague? So while it's mainly contained in Domain 5 and in the skills section, which is Domain 6, it does actually start off in Domain 1. And we would say that this idea of collaboration and multidisciplinary working and interagency working runs right through, rather like a golden thread through the standards. So we're always emphasizing the communication skills. And communication skills were felt to be so important that we actually pulled all the communication skills from each of the other domains all together into one section in Domain 6. And while this is a little bit techie, in the next couple of slides you'll see that the idea about working with colleagues comes through again and again. And it starts off in Domain 1 about talking about effective, authentic and meaningful communication skills, and that's with colleagues as well as with women and their partners and so on. And it's about person-centered relationships, so it's that building on the relationships, because there's no doubt midwifery is a relationship-based profession. It's all about developing the relationships. We have a finite length of time to develop relationships with women, but it's absolutely crucially important, because that relationship can, and the way we handle it and the outcome of it affects women for the rest of their lives and goes into the public health arena that we were talking about earlier. So the domain 1 is around the being also the ability to be able to challenge colleagues in a respectful way. And again, that sort of mutual respect and recognition of each other's strengths. And then around the working with colleagues and multi-agency people in the management of, first-line management of emergencies and knowing when to refer. And if you go into the Domain 5, which is the one around being a colleague, scholar and leader, this talks about the promotion of excellence, which is where this sits within our standards. And it's around recognizing, as I said, your own strengths and developing the strength of others. And effective improvement strategies, knowing about the evidence behind quality and safety, sharing feedback and learning from positive and adverse. And that goes into, it was mentioned about huddles, and it's that sort of feedback at different sorts of levels within the organization, within your own workspace, very important. And understanding the principles of human factors, environmental factors, and strength-based approaches, knowing your strengths, knowing other people's strengths, and being able to work with each other when you're working with colleagues. And this is all around, developing strategies to contribute to safe and effective practice. And it's this effective and timely communication. So we're back again to the discussions around communication and its importance. And also, and this is actually really coming to the fore, it's about recognizing the vulnerabilities in both others and also yourselves, and the actions required to minimize the risks to health or the well-being of yourself and others. And I think in the environment that we all practice in nowadays, that's really, really important. And it's, I suppose, this is a lot to get into a curriculum for students, but it's important that it's sort of the emphasis is laid at the beginning and then built on as people go into practice and their field of work, wherever that takes them. As I said, the skills section of our standards pulls together in Domain 6 all the sort of communication skills and the others needed to practice as a midwife in the 21st century. And we've talked a lot about the communication skills and taking into account and having at the centre of it all the women's needs, views, preferences and decisions. And of course, the important thing about the decisions is that they need to be decisions based on evidence-based information, and that's where our communication skills come in getting that evidence and that information across in an appropriate way for the person that we're dealing with and working with and caring for. So in Domain 6, you'll see that there's a lot of communication about complex information, communicating that in a clear, concise manner, and to interdisciplinary and multi-agency colleagues and teams, and also about the ability to escalate concerns where it's needed for the well-being of the woman and her newborn infant. There's also, as I've said, about the discussion with women, partners and families about the information around options, and that's where knowing the evidence base and understanding and having that relationship with the women and the partner and the family, because it's often a collective decision in these sorts of arenas. So very important to have those communication skills ready and raring to go, as it were. And there's also about consulting, collaborating, and again, communication. And I could go on about 3 C's and all sorts, but there's about 75 C's, so I'll not go there, because it all does boil down to communication and collaboration and working with colleagues. So in those senses, I suppose that's the 3 C's: communicate, collaborate, and work with colleagues. So the final sort of section of Domain 6 takes us into the communication during medical interventions and referring to colleagues when there's sort of deviations from evidence-based feeding patterns and there's issues with the baby, or working with others as in the sense of advocacy groups and stakeholders to improve quality improvement. And that goes back to knowing about quality improvement methodology and so on. And change management. There's all sorts of large topics hidden, as it were, in the domains. And I think this is been picked up and developed throughout the curriculums, but it's not to underestimate the amount of information and learning that there is within these domains as they translate into the curriculum for our students. So there's a lot about encouragement as well of colleagues, and also that involvement in learning with students and also with other colleagues. And we've moved from a system of mentoring in the UK to a system of supervision and assessment. So it's one of these things that everybody is now expected to get involved with the learning with students in practice. So it's one of these things that midwives need to be very familiar with the standards of proficiency, because they will be supervising and in some cases assessing students. And it also comes in with midwives whenever they're thinking about appraisals, but also when they're taking a look in preparation for revalidation, which in the UK we do every 3 years as part of staying on the register. So I fed all of the previous slides into one of those word cloudy thingies, and I would be the generation that would tend to refer to, as one of my old bosses used to refer to it, face tweet, and I think I'd have to say TikTok snap, because I'm not terribly good at this, and I was dead pleased with myself that I was able to do this word cloud thingy. So as you can see, when I fed all of that in, what came out was the emphasis that we've already mentioned around communication, interdisciplinary, multi-agency, caring for women, recognising decision information, and so on. And key to this all is working with colleagues. So Karen talked about leading, and this briefly comes into Domain 5. And I'm not going to labour the point, but there's just a couple of things about leadership. It is possible to, learn the basics about leadership in your education programme, but the key thing that I would take away is that there's also following. So while you're leading, the key thing to remember is if you're leading and nobody's following, all you're doing is going for a wee walk by yourself. And there's a lot to be said for if your actions inspire others to dream more, learn more, do more, and become more, you are a leader. And followers who tell the truth and leaders who listen to it are an unbeatable combination. And there's one that I haven't written down, but I can remember because it always sort of stuck with me. I think it gets attributed to Henry Ford, but you know what Google's like, it gets attributed to absolutely everybody. But it's one of these ones, if you keep doing what you've always done, you'll always get what you've always got. So that's an element of leadership and of learning and moving forward and not repeating the same sort of mistakes. But I have written it down. Very good for me. And the one about following was basically this is the idea of somebody has to be the first follower. And this links back to if you're leading and nobody's following, you're just going for a wee walk. I'll not play it, but there is, if you wish to, there's a link to the first follower. And this is the idea that came through a TED talk in about 2010. And basically it's a bloke at a festival behaving like a buck idiot and jumping up and down and dancing away to the music. And then he's dancing by himself for a fair bit. And then somebody gets up to join him, and that's the first follower. And the next thing, they're all leaping about like idiots and waving their arms in the air. But the principle of it is that you have to have a message that somebody wants to follow, and then there has to be that important person who's the first follower who joins in, and then it becomes something that everybody wants to do. So a little bit of further reading for those of you that are interested. There's a little bit about governance and leadership, and this is coming through from the This Institute, which is led by Professor Mary Dixon-Woods, who is from, I think, Limerick, but I could be getting that wrong. But anyway, she's done some fantastic pieces of work with the This Institute, including there's one which is around the elements of 7 aspects of a safe maternity service, which is, absolutely groundbreaking work. And this is also around their governance and leadership and what sort of works and approaches to improving quality and safety in health and care. And then in leadership and midwifery, Dr. Sally Pissarro and colleagues have just written an international appreciative inquiry in midwifery around strong midwifery leaders and sort of what they look like and the enablers. So something to catch up on if you have time. And just from the point of view of the NMC, some things that we've produced around good leadership, meaning better care. And we've taken the principle that good leadership, good midwifery happens in partnership. And we have one little piece from Shona Hamilton, who's a consultant midwife in Northern Ireland. And her point is leadership's about showing we advocate for women and they have choice, and enhancing our midwives' knowledge, skills and confidence to provide that care. And we also have Wendy Iwolo, who is the National Maternity Lead at NHS England and NHS Improvement, and she's picking up on the fact that you can always know the kind of leadership that's in place almost as soon as you walk into somewhere. And staff will follow the leader as the role model, and the leadership's relationship with their team translates into making such a big difference to the care provided. So this was another little thing that I'm very proud of myself for doing, which is managing to do a QR code for a page. So for those of you that will be getting the presentation afterwards, feel free to have a look at our Good Leadership Means Better Care sort of hub and information. We've got, as I said, the various little vignettes from people, both nursing and midwifery, and we also have a series of resources around the code, and this covers things like professionalism and person-centred care, which are not necessarily specific to midwifery, but they do cover, obviously, our profession. We do have some students' resources as well, which may be of interest to those of you who are in the student space in one way or another. And we've done a series of little video clips for students in the UK about their journey through education, and the sort of the NMC, telling them what the NMC is about, and hopefully, as Karen was alluding to, demystifying it and hopefully reducing the level of scariness, because we were very aware that we would meet students and they would often say to us that they were scared of losing their PIN, which was really worrying because they hadn't even got it yet. So what we'd like to do is to build on our resources for students and hopefully demystify the NMC, because there's much more to it than the fitness to practice side. And our final point, which I'll just whiz through because I'm running out of time, is that we're going to be looking at advanced practice, and we will be drawing on the expertise from your good selves, because Ireland, I think, is the one country in the world that regulates advanced practice in midwifery. So we've done some preliminary work, and we're going to be doing some more as our council has advised us to sort of go on to the next phase with looking at advanced practice. So there's lots of information online around the work that's already been done and the independent reviews. And I would just like to say thank you very much, and I hope that you've lots of questions for us.
Thanks very much, Verena.